Our group's presentation today is on Rwanda and the examination of aid effectiveness in the local context. Rwanda is the most densely populated African country on the continent, but it is most often associated with the genocide of 1994. Over a period of 100 days, 800,000 people were killed. It was been described as the most calculated, brutal and efficient ethnic cleansing the world has seen since the Holocaust. Today, 84% of the population are the Hutus and 15% are the Tutsis. But since that time there has been a great improvement in Rwanda, with the GDP per capita growing fourfold in the last 20 years. However, while the gender ratio is even, there has been significant issues with gender-based violence against women. In 2006, a local NGO was founded in Rwanda called RMIT, which stands for the Rwanda Men's Resource Centre. Rwandan men were wanting to see gender equality and women's empowerment. It is an organisation that is mobilising communities to reject gender-based violence, and significant changes have been made in a country where women have often been oppressed and men have been the dominators.
Even with over 50% representation of women in the Rwandan parliament and government commitments to promoting gender equality and equity, lack of equality for women and gender-based violence remain significant issues. The United Nations Development Programme funding is focused on addressing gender-based violence and enhancing health, governance and the protection of human rights. The Rwandan Men's Resource Centre project was designed to promote positive and non-violent forms of masculinity and building a network of social change agents as role models. A key element of the project was to raise awareness that gender-based violence is men's business too. Strategies to raise community awareness at the local level build the capacity of other organisations to respond to gender-based violence and develop transformation models have been utilised. The project focused on formative research with men in selected districts on links between gender and masculinity, sexuality and health risks. The research informed the development of training modules to be used for training the trainers and community mobilisers, encouraging men to become agents of change by reflecting on their own history, particularly in relation to gender equity and gender-based violence. A series of advocacy events at local and national levels aimed to increase public awareness on these issues and raise their profile amongst key decision makers and other strategic partners in development.
The effectiveness of any aid initiative is most evident by hearing of the impact from the recipient's point of view themselves. In Rwanda, with a patriarchal society, men have been the perpetrators of domestic violence, something significant in a post-genocide context. RMIT has shown they can also be the point of contact for change. The programs of this organisation have had significant impact on the people of Rwanda, and it can be viewed from the perspectives of both men and women. Men have been able to fit back into society, using village savings and loan schemes that are an entry point to engage men as supporters rather than opponents of women's economic empowerment. They have also seen altered views on gender. The Men Care movement has been looking to a man's role in the family as a caregiver. RMIT provides training to men on new roles in the family as it combats gender-based violence. The challenge remains, however, as there are women who accept and support men being positive and not behaving violently, but there are also others who believe that men should not behave like women. But one man stated that most importantly I learnt to include my wife in decision making, especially in money matters. There has also been acceptance of change, with the promotion of the concept of positive masculinity, and now there are over 3,000 local leaders who have been trained. It's summarised well by one man who said, "My family is peaceful now, and we came to know that our wives are our colleagues." The effectiveness of these programs can also be seen in the impact upon women. The cultural norms and taboos have often bound them to a demeaning position, accepting oppression by men. There has been the impact of healing from violence. They have participated in couples dialogue evenings and parents dialogue evenings. The challenge is enormous because despite progress, 48% of women aged between 15 and 49 have experienced physical or sexual violence at some time. Women have been encouraged to take on new roles, with one woman summarising it by saying that, "I wished for death to take me away because my husband oppressed me." Today this woman is the vice president of an association that fights gender-based violence. There has also been the impact in seeing the access to employment, finance and rights for women. No longer do women need to feel subservient and have been empowered with the right to decide for themselves. One woman declared after the RMIT course, "I can now decide to build a house, and do it." Women also report that gender-based violence has drastically reduced in their households following the courses being run by RMIT.
Addressing the intra-household power relations is one of the mismatches in RMIT's work. Despite healing process for women, 48% of them have experienced physical or sexual violence in time. Studies confirm that the intra-household power relations is one of the main contributing factors towards gender-based violence. Therefore, to end gender-based violence requires addressing the power relations that exist in homes. Secondly, village savings and loan schemes that are an entry point to engagement may further empower men to further abuse women and girls. Thirdly, while women taking on additional roles is a positive contribution from the intervention, this can also add additional burden or workload and further disadvantage women. This was confirmed by a number of studies, including Asian Development Bank project in the Philippines and East Timor. Moreover, it contributes to the increased child labor as mothers take more roles or by spending more time away from homes. However, there is potential for RMIT's work to be further strengthened. This is by strengthening mechanisms and systems such as policing and legal services for effective referral pathways that can reinforce RMIT's work in addressing gender-based violence. This is because RMIT is being implemented in post-conflict contexts, and in such contexts, government capacity is usually weak or non-existent, or state institutions are either dysfunctional or requires complete re-establishment. Secondly is to develop policies and strategies that should also address the power dynamics present within homes in Rwanda.
Aid effectiveness would be improved by development coordination and cooperation to foster a more integrated approach to changing behaviour rather than one-off grants. Undertaking gender-specific research would support better strategies for women, avoiding unintended consequences, and a focus on collecting relevant data at the local level using different techniques would support the fine-tuning of activities aimed at reducing gender-based violence. In summary, this project in Rwanda has shown some positive alignment between the objectives of the donor UNDP and recipients. However, improvement is needed to better match donor objectives with community need for more effective outcomes and to avoid unintended consequences.